We think we have found an extraordinary guest. We think we have found somebody who is going to love the fact that Sadiq Khan could be knighted in the New Year's Honours List. Should we put it to the test? Here's Mike Buckley, former Labour Party advisor. Mike, a lot of people very disappointed listening to the programme today that Sadiq Khan might be knighted. Can you change the trend of today's show and turn around and say, yes, it's a brilliant idea?
I will very happily do that, yeah. I like Sadiq a lot. I think he's a good man. I think he's very well-intentioned. I think he works hard. I think he's shown staying power in politics, which, as we know, not every politician does. And I think he does that by working hard, by listening to the people who he's responsible to, the people of London, and working on their behalf. Has everything been easy for him? No, he hasn't. But the vast majority of the time he was mayor under a Conservative government that did everything it could to make his life difficult and to prevent him doing the things he wanted to do. But he's stayed the course, and he's built lots of housing, and he's got free school meals for kids, and he's given lots of young people opportunities. He's cleaned up the air in London, which benefits all of us, whether we live or work or do both in London. And he's doing what he can to work with the police to bring crime down.
Now, let's talk about Sir Keir Starmer's speech yesterday from Pinewood Studios. This is supposed to be the reset of his relationship with the British public. And he's sort of repeated his mantra quite a few times now that, yes, he's been forced to make some unpopular decisions, but in the long run, people are going to thank him. And yet, when it comes to things like tax rises, a very unpopular decision, he hasn't ruled out whether or not he will have to go back to the British public with the begging bowl again. And yet, at the same time, we've had a poll out that shows that Reform has overtaken Labour in the opinion polls, pushing the government party back into third place. Do you think his little speech yesterday is going to do the trick? Do you think the general public in the future are going to get on board with all of Sir Keir Starmer's programmes?
I think they will in the end, but I mean, I don't think a speech is going to make a difference. But I don't think that Keir will have thought that yesterday's speech would have shifted the polls, because in the end, what's going to move the polls is people feeling different about their lives and their opportunities and their access to public services, the future of their children, or, you know, the well-being of their parents as they approach older age or are in older age. You know, it's the nuts and bolts of reality. And when, again, we've just been reading today and yesterday about the NHS crisis, because there's been big rises in COVID rates, people hospitalised for flu, RSV, for norovirus, you know, as well as all the other things that the NHS has to do, which is, of course, the overhang from 14 years of underfunding under the Conservative government. So Labour, 5 months in, is doing what it can to deal with all of these things. But as Keir said, I think this morning or yesterday afternoon, people are not going to find that their public services, including the NHS, are magically better by Christmas, because turning these things around takes longer. And I think at the moment, we should listen to what Keir Starmer and his ministers have to say. We should consider the proposals and the plans they put forward and think, well, are these credible? We should understand that, yes, these things cost money. They had to find money from somewhere. They've chosen where to get money from. You may like where they've chosen to get money from, as in primarily from increasing national insurance on employers, or you may think they should have done something else. Time will tell, and maybe they could have made different choices. But this is where we are right now. They will be judged in 5 years based on can you get into A&E within 4 hours or 12 hours, whether an ambulance turns up when you're sick or when a relative is sick, you know, whether you can get a GP appointment, whether your young children, whether your offspring can get a job or can get on the housing ladder, for example. All of these things they will be judged on. For now, it's too early to say. And to be honest, I'm not surprised 5 months in, they're struggling in the polls. I did see the one where they were behind Reform. It's an outlier. I was looking at the most recent pollsters before we came on. Labour's ahead in most of them by 2, 3 or 4 points. The Conservatives are ahead in a few. So I think this is an outlier. Were it to be replicated multiple times over the next month or the next 6 weeks, then Labour would have cause for concern.
Shall we have a little look as a little trio? Let's put our heads together and go through Sir Keir Starmer's new promises and have an estimate of whether they're going to be able to be achieved or not. So the very first one is the 18-week NHS waiting list. He wants, 95% of elective surgeries to be done within 18 weeks by the time it comes to the end of the current tenure. But the NHS itself is saying, well, if we're prioritising elective surgeries, this is going to have a huge impact on things such as A&E. How's he going to do it, Mike? Do you reckon he's going to achieve that one?
Well, I think he will, but I do think it's going to take time. I mean, Wes Streeting has the perfect response when he's asked this question, the Health Secretary. You know, when he's asked, he says, well, we'll do it this time because we did it before. And indeed, when Labour was last in power, they did bring waiting lists down, and they did make sure that people didn't have to wait. I think it was the limit was over. It was 4 hours in A&E. But they set very, very clear targets when they were in power before in the 90s and the 2000s. They met those targets, and when they left office in 2010, public satisfaction with the NHS was at record levels because it worked. Because people could get the healthcare that they needed. Having done it before, Labour has a good claim to say we are the party that will do it again.
Yeah, Tim, I mean, on that, I'm going to make a cheeky little confession here. In the run-up to the election, I said to my other half, and, I'm not going to disclose who I voted for, but it wasn't the current government. But I did say to my other half, at least actually, maybe we'll start to see the NHS back up on its feet. Do you think he can achieve that goal?
I think he will achieve that goal, but I'm generally a sceptic about targets, because what happens when bureaucracies are given targets is they focus on that one thing because their political masters need that thing to be done. But what is lost in the process, what resources are switched to get that target over the line, from preventative medicine or building up infrastructure, whatever. So, yeah, the system will now be completely geared to serving these new objectives, these targets of the Prime Minister. But there will be a hidden cost that we probably will only really understand and appreciate in a few years' time, perhaps after even Keir Starmer has ceased to be Prime Minister.
Hidden costs a bit like sort of private finance initiative, that sort of thing?
No, it's just, if you tell a bureaucracy this is what the Prime Minister wants and it's all about elective surgery, they'll probably make it happen, but they will divert resources, they'll divert expertise, they'll divert professional focus away from other things that aren't targeted. And that's the danger.
Let's talk about one of his other promises or pledges, that he wants to increase household incomes. That, to me, is a rather more amorphous concept. How on earth is he going to do that when a lot of small and medium-sized enterprises are already saying we're going to have to let go of staff because we can't afford them under increases to employers' national insurance and increase to minimum wage? You've even got hospices saying they're going to have to get rid of staff. At the same time, the government's trying to push for assisted dying, which I find quite disturbing. But how on earth is he going to be increasing household incomes when it seems to me in his budget he's battered business?
I mean, we've got a problem in our country. So real wages haven't really gone up since 2008, since the financial crisis. That is not normal in most countries. That happened in most countries in Europe and certainly in the US. I mean, their incomes and their productivity has gone on, huge amounts since 2008. So something strange has happened here. That is in part due to the last government, I would say. So its austerity program, where it sucked lots of money and investment out of the economy in the early 2010s. And then indeed Brexit, of course, had a huge impact on our economy as well. None of it beneficial. Regardless of how you voted, that's been the outcome, I'm afraid. So this government's come in and said we're going to do certain things to make things better. So they're going to reset the relationship with the EU, improve our trading relationship, we hope, next year, in the next few years. They're going to reform the planning system so that it's easier to get things built and it's easier to make things work together. And that is a huge thing.
Ironically, to reform the planning system, you need to get rid of a load of EU regulations.
I don't know whether that's true or whether it isn't, but they do want to reform the planning system anyway, and that will then help them build housing, but it would also help them build other infrastructure, for example, train lines. It will help them get green energy, for example, connected to the grid so we get cheaper electricity. All of these things collectively will help the economy work better, and we have to improve productivity in this country, which means that every hour of work we put in, there needs to be more economic value that comes out. There's no magic bullet to that, but the government thinks it's got a plan through various measures, including education, including changing the planning system, including resetting relations with the EU, to make that happen. The consequence will be that our incomes will go up.
Well, only time will tell. Mike Buckley, thank you ever so much. And thank you for coming out in support of Sadiq Khan. Someone had to do that job, didn't they?